As many of you are aware, the deadline for Medicare open enrollment is quickly approaching in December. The dates are very important for anyone out there who qualifies, also to the caregivers who may be assisting others in signing up. Joining us now is Dr. Anna Aguila, a primary care provider with Healthcare Partners, a DaVita Medical Group. Welcome back to the show, Doctor.
Thank you for having me.
Great to have you. Okay. This is a great chance for us to get very clear on two dates.
Right.
December 7th is a very important date. Also, a lot of people are thinking about what happens on December 15th. Please tell us which is which.
Okay, so there's two open enrollment periods. So one for the Medicare and one for the other insurances that is offered through the marketplace. So the marketplace deadline is going to be on December 15th and the Medicare is on December 7th. So the caregiver should need to know the difference between the two.
Yes.
So.
And you were sharing with me, it can get a little confusing because if you're helping someone in your home, in your life, enroll for Medicare, you might have that December 15th deadline in your head. That's for regular health insurance. December 7th is the final date for open enrollment for Medicare.
Yes.
Okay. All right. We've
Correct.
got it. We've got it on our calendars. So I tell you, sometimes it takes multiple reminders to really get that date straight, doesn't it?
Yes.
And let's go ahead and talk about open enrollment. There are many people out there in Vegas who are, bless them, are caring for other people and helping them enroll. They want to make sure they help them get the best plans possible. What is important for an individual, for a caregiver, when looking at a Medicare plan?
So what the caregiver should know first is what Medicare is. So Medicare is something that 65 and older should be proactively enrolling into. So Medicare does not happen automatically. They have to enroll. So they have to remind their parents, grandparents to participate in the enrollment period. So with the Medicare, they have to know exactly what their family members needs for the coming year, because in the original Medicare, some of the long-term care, the nursing homes, dental, vision, hearing, they're not covered. But with Medicare Part C or Medicare Advantage plan, these plans can pay for the cost of these services. So the cost for enrolling in Medicare Advantage is the same as enrolling in the original Medicare plan. So
that's really just a profound thing to pause on there for a minute. So the cost of enrolling in Medicare Part C and Medicare Advantage plans is no different than regular Medicare.
Right.
Okay, so why wouldn't everybody then enroll in those higher plans?
Well, with the Medicare Advantage plan, they can provide these patients with like chronic conditions. They have special programs for those that have like maybe chronic conditions. So it's really important to kind of evaluate what the needs of that family member for the coming year. So let's say the family member may have probably a new medications, new diagnosis, managing a chronic conditions, or just had a recent surgery. So it's very important to kind of review the specifics of each plan so they can choose what's best fits their family member.
Yes. Now, you shared with me you work at a general practice at Healthcare Partners.
Yes.
You see many patients, and what you have at Healthcare Partners is something called the Total Care Model.
Yes.
Explain to me what that is.
So with Healthcare Partners, we practice this total care model wherein there's a team of medical professionals that works closely together so that we can render the highest quality of patient-centered care. So as we know, as the healthcare needs changes over time, this can require like additional support and education.
Yes.
So it is important that you have a healthcare partners, providers, and care team that can provide that extra level of support and care.
Yes, an extra level of care is valuable indeed. Tomorrow there is a very fun event where people are invited to come down, get great information about Medicare, and there's a little treat. Tell me about it.
So Healthcare Partners is hosting this movie and Medicare event, and that's going to be tomorrow, November 15, Wednesday at Red Rock Casino at Summerlin. So if you want further details on this and the upcoming events, they can visit that MedicareMadeForMe.com, and they can also call the number on the screen.
Come down, get more information about Medicare, and get popcorn.
Sounds yes, so they have these entry door prizes and then popcorn and a movie.
So much
which
fun.
No cost to attend.
No cost to attend. Thank you so much, Doctor.
Thank you.
Again, you have until December 7th, folks, to make your selections for Medicare open enrollment. Visit enrollwithmedicare.com to learn more about your options. Healthcare Partners, a DaVita Medical Group, has locations throughout Southern Nevada, and they are proud sponsors of the Morning Blend.